Cayman's top news headlines of the day from CMR.
Oh, good morning, Sandy. How are you?
Morning, buddy.
Happy Monday to you.
Happy Monday. I think we got everything working today, I hope.
Yeah, I mean, Mercury's in retrograde on a Monday, I think.
I guess that's a good sign.
How's it going?
Yeah, good.
All right, what you got for us?
Headlines today include second case of monkeypox being discovered in neighboring Jamaica. Of course.
Oh, no.
Yes, this falls on the heels of just over the weekend, the World Health Organization essentially saying that this is definitely going to be something to be concerned about. And so they have raised the alert on monkeypox. So we all need to be on the lookout because it's coming, essentially, is what they're saying, because it's spreading a lot faster than they would like or they anticipated. So, yeah. In other regional news, we also had, unfortunately, 17 Haitian nationals who lost their life trying to get to the Bahamas. So their boat capsized yesterday.
Oh, no.
Yeah, like literally right outside Bahamian waters. So a bit of sad news for the Haitian community this morning as well. You know, they've had a mass exodus, really, of nationals trying to leave their country as well because of the economic times right now, just like the Cubans. And unfortunately, I think the Cubans have several options just because of their different routes, I guess. The Haitians don't have quite as many, so they're either trying to get to Miami or the Bahamas, which is a little bit of a further distance. And so, yeah, they ran into some issues. Kind of sad. Just trying to see what else we. Oh, right. So, I don't know if you've been following this case coming out of, again, a little bit of regional news coming out of Jamaica or not, but there has been a young lady who was said to be a social media star or influencer or something. Sorry, that has gone missing. Her body has been discovered, but there's big controversy around it because apparently they're alleging, her family and others, that the persons who killed her were two police officers, male and female, who were in a relationship. It was like a threesome sort of thing. Like she was in a relationship with the male officer.
The triangle.
Yeah, he was also in a relationship with another female officer. And so it's crazy. It's making headlines all over the region. But they did discover her body over the weekend. They think that it's her. I think they're about to finalize that. And so lots of questions around that. We're actually going to have an entire show dedicated on Wednesday on this topic, including a former FBI agent who's going to be joining us to talk about, crime in Jamaica and kind of what's happening there, because it's shocking when things like this happen. So it's leaving the community, even for a community that's used to kind of certain things, it's still leaving them really, really shocked about the rollout of these events.
Sounds like a Dateline.
Yeah, right. A resident care worker here in the Cayman Islands is being accused by other residents and their parents of assaulting a 13-year-old child at the Francis Bodden Children's Home. There's some sort of altercation that went down that left the young lady with a busted lip. And the residents are complaining that, no one has bothered to, inform the police, and there's no proper investigation that is going on. Our CIPS is looking for two individuals currently. One is Mr. Luisto Azabeo Hernandez. I probably totally messed up that name this morning, but they're looking for him and Charles Walton III. They're on the police most wanted list, which here in the Cayman Islands I think is pretty short. But
what they do?
One is this particular one, the 27-year-old Luisto, is wanted for firearm offenses. He's said to be violent and is believed to be armed and dangerous. So anyone who sees him is encouraged to contact the RCIPS right away. And then Charles Walton III, he's probably no stranger to many of you because he was wanted not that long ago by the authorities as well last year. And he's wanted again. So this time, again, firearm offenses, and they said that he's known to be violent and is believed to be armed and dangerous. So a lot of people are asking, like, how was he wanted again? Did you guys just let him go? But apparently those were unrelated offenses.
All right, you got to jump. Catch Sandy Show right now on Bobo 89.1 FM. We'll see you tomorrow.
Thank you.
All right, let's with CMAR brought to
you. All right, folks. Yeah, the time flies by so quickly. Good morning. Let's get it here in just a few seconds.
Peppermint, sorrel, ginger, beaver grass, or English. Get it ready. Your morning tea just got hotter.
Ooh, honey child.
On the cold, hard truth. Bobo 89.1 and Cayman's #1 talk show are bringing you morning talk like no one else. Monday Rewind, Impact Wednesdays, Caribbean Connections, and much more. Don't miss a beat with what's happening in the local community. Just keep sipping your tea.
What a mess.
Here's your host, live and direct from the Cayman Islands, Sandy Hill. Peppermint, sorrel, ginger, beaver grass.
Oh my goodness. Good morning, everyone. How are you guys doing? Oh, my apologies for the coughing in the microphone this morning. What can I say? This cold has beat me up over the weekend and it doesn't appear like it's done yet. So I guess we're in for some fun times up ahead. Yeah, kind of rough. What can I say except that I'm taking, what I can for it. Got some tea this morning, along with my usual water, some overnight oats, and we just have to ride it out. Just one of those things. So I hope you guys are doing well. Hopefully all of you are feeling a-okay today. Happy Monday. Somebody was saying to me over the weekend, oh my gosh, you're sick. How are you going to do your show? And I said, well, unless I have no voice at all, I'm here. So, or unless I'm like really, really in bed. So over the weekend, I spent quite a bit of time in bed all day, pretty much Saturday afternoon. I was sleeping, like the body just needed the rest. Under the circumstances, I said, you know what? Just take it. Just rest. Yes. So Sunday, it was much the same. I did muster enough energy to get up in the morning, fix a little breakfast for the fam. Had some nice eggs and bacon and hard dough bread. And I did real bacon yesterday, not turkey bacon. Most days I do turkey bacon. I thought, let's just go out and have some real bacon. So lots of things happened over the weekend, which we will get into this morning. I'm hoping that you guys can hear me okay. And I think that we have I was going to say, I think we have the phone line sorted out, but it looks like the phone's actually dead. It would have helped if I charged it, right? All right, so let me put that on charge. We'll get there. So yes, it's, I think we've got everything sorted out now. A couple of things that we were not expecting with the board, but I'll tell you guys about that a little bit later on. So anytime you get a new piece of equipment, you know, there's a learning curve. You've got to learn how to use it. And there's a couple of things that I had to quickly get caught up on that have changed since the last one. Same company, some things are similar, but some things are completely different. So I've got all my sounds back. I know some of you, including Anthony, will be happy to hear that. Good morning to Diamond Princess. Happy New Week, she says. Good morning to Miss Joy, who's joining us from Texas, one of those Caymanians that's living abroad. Good morning to Marshall. How are you? Miss Reba. Hey, Miss Reba, I don't see you on here often. How are you, my love? She said good morning, and she's thanking God for another day. Yes, indeed. We've got Evelyn. Aliano from Windsor Park is joining us. Evelyn, are you still in Europe where you're experiencing hotter temperatures than we are here in the Cayman Islands? Melita's got it locked. Speaking of hot temperatures, did you guys hear this? This was so sad. Apparently some little chickens lost their lives in Miami at the Miami International Airport after they were trying to make it to the Bahamas. I didn't really think that, like, is there a chicken shortage in the Bahamas? Gosh, we could send them some. We can pack some up and get them quicker, probably. But they were en route to the Bahamas to farm there, apparently. And it was so hot outside. They left them outside. Well, I don't know. It didn't sound like it said a couple hours, you know, but that's enough to kill baby chicks, apparently. It really is when it's like 90-degree weather. So unfortunately, over 4,000 or just about 3,900 chickens lost their lives, and they were able to save about 1,300 of them. So this has been something that they have been doing for quite some time. And the farm in the Bahamas, sorry, so they've never seen anything quite like this. So they were so shocked. I think someone forgot about the chickens or something. It was crazy. So poor chickens had an untimely demise. So yeah, this was, they were found in a cargo warehouse. So although they were in the warehouse, it was still, oh my gosh, sorry. So they were on a Delta flight, which landed at Miami International Airport at 1:16 p.m. on Tuesday. And the chicks were discovered, the birds were discovered some 4 hours later. Temperature at the airport was 90 degrees at the time, which was the high for the day, and a feel-like temperature of 98 degrees. Asphalt temperatures apparently increase the feel-like temperature 40 to 60 degrees. So the asphalt itself can be 40 to 60 degrees higher than the air temperature. So imagine that. It's no wonder it was melting in the UK the other day. I never knew that, but it makes total sense when you think about it, right? So 5,200 chicks were trying to get to the Bahamas when they met their demise. Now, I was kind of thinking about this. They were on a Delta flight, which landed at Miami International Airport. I wonder what their original port of entry was. Let me see if we can figure this out. So, yeah, this made news all over the place. Oh, they were coming from Minneapolis, St. Paul. Huh. Okay. It's interesting that you'd have to get chickens all the way from there. Like, why not get some just from Miami and send to the Bahamas? Anyway, they were loaded on metal baggage carts, which, as you can imagine, probably got even hotter, and sat under the Florida sun for some time being 4 hours later when they were discovered. Oh, my goodness. So the Florida Department of Agriculture and Consumer Services was notified on Tuesday afternoon that the birds had died as a result of excessive heat while awaiting transport to the Bahamas. And like I said, some 1,300 still made it to their final destination. But poor little chickies. My goodness, so sad. So yeah, I don't know exactly why the Bahamas need chickens, but anyway, they were going to a farm there that has been doing this for 27 years. They've been in business for 27 years. Maybe it's to add variety to the chicken stock. I'm not really sure. And so they said that in their 27 years, the Abaco Big Bird Family Farm said that they were horrified by what happened, and they'd never seen anything like it in 27 years of being in business. So, of course, everybody's blaming somebody else. So employees of Elan America, which is an airport auxiliary service company, who were in charge of the loading and unloading of cargo on the aircraft, said that the transportation and delivery is done by another company. So who knows who's ultimately to blame for this, but this is now a contractual situation, so somebody will have to pay for the loss of the chickens. But wow, what a way for those poor chickens to go. They just said, the company said that we can understand and sympathize with the concern for the situation, and they didn't make any further comments, citing an investigation. And Florida Agriculture Department said any investigation into the incident should be conducted by law enforcement officials. I wonder what they mean by that. Does that mean that this could potentially have some implications like criminal charges? You killed a bunch of chickens? I think it's just, chickens, probably like dogs and other animals, are considered destruction of property. So, it's probably going to be more of a contractual situation than anything else. Good morning to Miss Melita. Lady Gangsters here. Good morning, Felicia. Miss Gina's got it locked. Barbara is also here. Miss Iva, good morning. Vernita. Sonia says, bright and cheerful morning to one and all. Miss Vernita says, I pray you feel better soon. Thank you very much. Yeah, these colds sometimes can just knock you flat. Trust me. You're glad that it's nothing more serious. It ain't the COVID. So praise the Lord for that. And let me find my praise the Lord button so I can have it ready. So all I can say is, here we go.
Praise the Lord.
Yes, absolutely. So yeah, it's just one of those things, Miss Vernita. Got my annual cold and I'm about. Everyone knows that this year they're saying is going to be one of the worst flu and cold seasons in a while, because we've all been kind of, bundled up and hidden and whatever. I think I might get a flu shot this year. I don't normally get a flu shot, but I think I might do it this year just to give myself that little extra boost of protection. And just last week before I caught this, I was saying that I want to go in and get myself another COVID shot, because that seems to be coming for a lot of people as we speak. Lots of people are catching the COVID. You little brat, good morning. And in fact, we've got some COVID news for you. So honey, she says teaspoon 3 times a day. Processed crap doesn't work. Miss Morna, good morning. Normally by the time you catch it, it just has to run its course. Anything that you take will only be to assist with the symptoms. We know that zinc is scientifically proven to lessen the duration of these. So I have been taking lots of vitamin C and zinc. And you shouldn't overdo the vitamin C. It's not actually good for your stomach, I think. So Miss Corrine, thank you for joining us. Irvelyn is here. She says, still in the UK. Mami Ayena, good morning. Damien says they're layers for eggs, maybe. Yeah, I'm guessing. I don't know. Is there a shortage of chickens? And I feel like we could do more with the chickens that we have here running around the place. Like I feel like some farmer needs to gather them up and do something with them. Good morning to Hero Blair. He says, I'm here as usual. Good morning, Sandy and family. You shall be well. Thank you very much. Katsina says food destruction. Yeah, I don't know what the charge would be, honey child, but probably not much of anything. Good morning, Miss Wee Wee. Jonathan says they would have to come up with a better raffle if you want me to take another shot. Well, folks, listen, COVID is here. It's not going anywhere. But despite that, there seems to be a few bits of misinformation that's out there. So first of all, over the weekend, there was a very, very interesting article about the fact that there is an increased chance of you getting other things. So, for example, you're more likely to have a heart incident. I'm just trying to find the article so I can pull this up for you guys. You're more likely to have a heart-related incident when it comes to COVID. Heart attack and diabetes is significantly increased when you are COVID positive. So I thought this was kind of interesting, actually. But from what we heard, even when we had the experts coming on early on, like last year and stuff like that, the cardiologists and what other people were discovering, it's not entirely shocking or surprising to me because apparently COVID, what they've discovered, the virus itself, essentially attacks every single major organ in the body, which is highly unusual. So what they have now discovered is that there is a link between COVID and diabetes. It is for a particular infectious period after you've had the virus. So this is what they have said. This is a study published in the PLOS Medicine by researchers at King's College London. And they said that particular vigilance is needed in the period after catching the coronavirus. So apparently, scientists have noticed that you have an increased chance of the onset of diabetes, which is higher in the 3 months after a COVID infection. So if you've had COVID and you have other probably high risk factors when it comes to diabetes, this is something that you've got to pay attention to. So maybe, make sure you check yourself. You have home kits now where you can check your numbers. Because if you don't check your numbers, you could go into, what is it called? Ketosis or whatever. So you've got to, you can go into, it's not as hard to die from diabetes and not even know that you've had it, right? So this is something you've got to be very, very careful with, where your sugar levels go extremely high. So they did say that it returned to normal after 23 weeks. So it's like that first 3-month period that you've got to be very, very cautious. The high risk of cardiovascular disease also lasts for about 7 weeks. And this is an increased risk, I should say, high risk of cardiovascular disease. And this is interesting because remember when the vaccine first came out, there were a lot of people who were like, oh, I've got heart troubles, or, I'm worried about the instance of myocarditis and other things as it relates to the vaccine. There was a small amount of men, younger men, who were showing signs of myocarditis, but then they got over it after a certain amount of time. I remember when we had the cardiologist on the show. He was very, very interesting, extremely knowledgeable. And a young lady had written in or called into the program and said, she's a heart patient. She has something wrong with her heart. Should she not take the vaccine? He said, in fact, what they are discovering, and again, as a cardiologist, he saw a lot of patients. He worked in, Florida in emergency rooms, and he's seen thousands of COVID patients at that point. And he said what they're discovering is that your chances of having heart-related issues because of COVID itself is far higher than anything that you have to worry about in relation to the vaccine. So, they said protect yourself from the ill effects of COVID by getting vaccinated. And of course, now we are probably at least a year after he's appeared in the program, where the researchers at King's College London have said that there is definitely a link between an increased chance of diabetes in the months following a coronavirus infection, as well as a higher risk of cardiovascular disease lasting for 7 weeks. So the study is there. You can certainly go read it for yourself if you'd like to dive a little bit deeper into that. They're just saying that vigilance is what's important. So within that 3-month period, and we know people who are actually being reinfected. I'm going to talk about reinfections here in a second. But within that 3-month period, you've got reason to be concerned for other stuff. And of course, we know that, at this point, most of us are like, oh, well, COVID isn't killing me, so I'm good. You need to be concerned a lot more than, well, I guess death is the ultimate, right? If you die, then you don't have any worries at that point. But there are other things, if you are alive and you've had a COVID infection, that you actually need to be concerned about. And long haul COVID is a thing. So for this particular case, this particular research, it was a study group of 428,000 patients were used for the research. And there was an 81% more cases of diabetes diagnosed in the first 4 months after a COVID infection. And the risk remained elevated by 27% for up to 12 weeks. So the coronavirus was also linked to a 6-fold, that's 6 times increase in the diagnosis of cardiovascular conditions, but the risk again declined after 5 weeks after infection and returned to baseline levels or lower within 12 weeks to 1 year. So it does seem to eventually, go back to normal, provided you don't have a cardiac or diabetes incident, which would complicate your life beyond just the COVID infection, right? So this is why it's really important, to, as they say, just remain vigilant and speak to your professionals. That's what you got to do. So, yeah, I'm going to get boosted again. I had no issues with the first 3 shots at all. And hopefully the last one will not be an issue. But now that I have this infection, remember, if you have a cold or whatever, you can't really do it right away. You've got to wait until this is cleared out of your system. So I think I've got to wait like a couple of weeks or something after I've had like a cold or whatever. So yeah, so I'm looking forward to getting boosted. Now, you see how things can happen, right? Imagine if, because early last week and the week before, I was like, oh yeah, I need to go in. So let's just say that I went in and I got the vaccine. All y'all would have been blaming, oh, Sandy, you got this cold or whatever this is because you got vaccinated. And I've always said, and something I want to stress here, is a coincidence in time does not prove causation or anything else, because you could see whatever this is, it was coming for me regardless. And so a lot of people would jump to conclusions about the fact that I got this cold had I been vaccinated because I got vaccinated. It's amazing how people think. And I try to be as sensible as I can when it comes to, health related things and medicine. I try to let the experts do their jobs. Someone was saying over the weekend that, when I shared this post on our social media platform, about the increase of whatever. They're like, yeah, you see, that's what I told you about getting vaccinated. I'm like, well, I would have to look at the specific research, but there's actually no indication. They didn't specify in the synopsis of this. And again, without going into the actual study itself, they did not specify or if these people were vaccinated or not vaccinated. So I'm not really sure how this person jumped to that conclusion. This person's obviously an anti-COVID vaccination person, but I thought to myself, how on earth did you conclude that this has anything to do with the vaccine? That's a leap that I didn't even see coming. I'm just like, what are you talking about? What does this have to do with the vaccine? And so their point is, oh, now they're trying to justify people having diabetes and heart conditions after being vaccinated. And I said, but what we posted and what I read in the preliminary paper said nothing about vaccinated versus unvaccinated. This was just about people who had a COVID infection and what the results were after that. So how do you jump to the conclusion this has anything to do with people who are vaccinated? And it's just like I cannot believe how much COVID has really opened my eyes about how people will come up with a preconceived notion in their head and they will try to force, it's a square peg, and they're going to force the rectangular peg, the circular peg, the octagon shaped peg, everything into the circle, or did I say square? Into the square. And somehow in their mind, it makes sense. And I'm just like, that, to me, that even defies common sense, in light of the fact that that information was actually not shared. It's like, if you want to be an expert and you want to be a doctor, a Facebook doctor, and you want to be a scientist, at least make sure that, especially for me, before you say something to me in particular, just check yourself because I'm going to be like, no, that can't be right. And that's not what was said. Like, I don't accept something just because you said it and you have no scientific background. You're not a doctor. You've not seen, thousands of COVID patients. You don't know anything about how research is done and all this stuff. And yet, you go around with a degree of expertise in your voice, spouting out misinformation that only a fool would even listen to. And, I don't mean to insult people when I say stuff like only a fool would only listen to, but that's exactly what I mean. So if you're insulted by that, then it is what it is. Someone else on Instagram, I think it was, made some comment about, big pharma, and blah, blah, blah. It's just like, oh my God. I mean, at some point, y'all really need to get it together with the whole big pharma thing and what you say about, big pharma and what your positions are, because again, it just doesn't make any sense. So this person was like, oh, that's what some millionaire wants us to believe. And I'm like, okay, because millionaires have nothing else to do with their time, money, or resources than to make up information. So this is what this person said. This person said, why are you not all just, okay, first of all, it doesn't make any sense, but why are you not all just want to believe? Okay, y'all tell me what that means. Why are you not all just want to believe doctors who would take advice from billionaire who is paying for the broadcasting of this information? I was like, what? So this person, they went and had a look at the actual study. Like, I'm shocked at how people would even comment on a post like that. They don't go and look at the abstract of the study. They don't look at the methods and findings. They don't see how the conclusions were drawn. Nothing about the summary, nothing about the supporting information, nothing. And it's just like, what are you even talking about? Most people who make those comments on social media have never looked at an actual study themselves. And the wonderful thing about it, which I love, is that we live in the 21st century and all of these studies are now available online. You don't have to take the media's word for summarizing it accurately for you or anything like that. So you can go and have a look at the research for yourself. And then if you have an issue with the research or the methods that were used, then we can talk about that. But again, most of you have no clue of how research methods are even deployed, right? Whether it's double blind or this or that or whatever, you just think that you're an expert in everything. So this was, it says, a cohort study from 2020 to 2021, analyzing electronic records of 1,356 UK family practices over a population of 13.4 million. Participants were 428,650 COVID-19 patients without DM or CVD. So DM being diabetes mellitus, I think is how it's pronounced, and CVD being cardiovascular disease, who were initially matched with, then they have control patients. So they took a batch of patients, COVID patients, and then they did control patients, another 420, like an equal number. So they matched them on age, sex, family practice, and did a follow-up to January of 2022. So outcomes were incident of DM and CVD, a difference in age, a difference in difference analysis estimated that net effect of COVID-19 allowed for baseline differences, age, ethnicity, smoking, BMI, systolic blood pressure, Charlson score, index month, and match set. It goes into a lot of detail here, folks. And again, they talked about how they did it, divided into 4 weeks from index date. So that was acute COVID-19 infection, 5 to 12 weeks from the index date. So that was post-acute. So they were looking at like the timeframes essentially after the COVID infection to see what happened to these individuals. And the conclusion that the research found was that CVD, which is cardiovascular disease, increased early after COVID-19, mainly from pulmonary embolism. So, we heard of a lot of people who were having, remember, strokes and stuff like that after COVID infection. Y'all were trying to blame it on the vaccine, which is interesting. Atrial, oh gosh, what is this word? Help me out, doctors here. This one is atrial, no clue what that word is. I would guess arrhythmias, maybe, whatever that means, and venous thrombosis. So that's DVT, like deep vein thrombosis is kind of similar, I think, to that. And that can kill you for sure. So DM incidence remain elevated for at least 12 weeks following COVID-19 before starting to decline again. And again, these are people without any pre-existing cardiovascular disease or cardiovascular issues or diabetes who suffer from COVID-19. And it says that they do not appear to have a long-term increase in incidence of these conditions. Now, I wonder if they looked at people who had a pre-existing situation, if it made it worse or made it more acute. So then they talk about why the study was done. What did the researchers do and what did they find? And what do the findings mean? So obviously someone has to interpret the findings. So it's quite a bit of information. I'm going to share the link for those of you who fancy yourself to be doctors or you're interested in scientific data. Go ahead and read it. It's actually quite complex information. The average person gets lost after the first paragraph. But I think it's good and it's important for people to see exactly how research is done. One of the reasons that I read it is because I'm like, wow, okay, they did this, like just from a common sense perspective, they did this, they did that, and that's good science. And so they talk about some of the strengths and limitations of the study itself. So they are willing to admit if there are any limitations to the study, right? And all of that is covered. So I'll put the link in the current chat. And again, go knock yourselves out. All right. Good morning. KK is here. So Damien says, did they say how many shots they had? So as far as I know, this one of the questions was not whether somebody was vaccinated or not, because that's not what they were looking at, right? So I do not believe that that information was extracted. But again, I haven't read the entire study myself. So that's why I give you the link. Go ahead and read it to see if that was one of the questions that they may or may not have asked. But I kind of don't think so. It was really the question that they were trying to answer is if someone is infected how does that impact their health post-infection, whether you're vaccinated or not. But let me see. But I don't think that they, I don't think that they really divided people up based on their vaccination status. It was just straight if you've had an infection, because apparently there was a very clear link there. But, you know, sometimes they go back and they try to answer additional questions, you know, in relation to it. So, yeah. I remember the cardiovascular professional, when he came on the show, he said, you know, if you saw what COVID was actually doing to people's hearts, you would go and run and get vaccinated. He said, trust me, the few mild cases of myocarditis were nothing compared to the devastation that he was seeing people suffer, even if they eventually survived COVID. In terms of cardiovascular issues, he said it was significant. And there was also a lot of talk about even the increase of diabetes and stuff, which we'd mentioned from at least last year, well before this study was done, because the physicians on the front line were actually seeing it for themselves. They were seeing it. They're like, there's now they have the data that backs up what they were seeing in the front line, but they could tell you, and I think Kevin will remember this, the cardiologist, I can't remember his name now, was saying, yeah, we see it. So we know that there is a definite correlation between people who are getting COVID and then all these other long haul issues. Now they're starting, now that they've had a little bit of time, although infections are on the rise again, 3.8 million, I think right now in the UK. You know, they are saying that now they have the time to go back and so many people have been infected. They now have large numbers that they can pull from, and they're able to scientifically confirm that there is a connection there. KK says, stay healthy and you'll be good. Simple. I wish life was that simple, actually, KK. Life is never that simple. Some of the healthiest people in the world drop down from all sorts of diseases on a regular basis, folks. You know, obviously being healthy, you're trying to do your part, but that's absolutely no guarantee. Are you not surprised when someone who's healthy, who eats well, who runs, whatever, falls down with a cardiovascular incident and they just die of a massive heart attack? And you're like, how did that happen? Because sometimes death is just coming for you, regardless of what you've done in terms of your health. There could be other things that, you know, it just is what it is. So Jasara said, I got my first vaccine 2 weeks ago and no reactions besides a sore arm. Yeah, the vast majority of people will have a soreness at the injection point, and that's it. You know, a few other people might have feverish, whatever. And I'm trying to think if I've ever, even like the flu shot, I never really have much of a reaction to that either. So it is what it is. Jonathan says, try some Saracen lemongrass tea, rub on some Vicks. Child, I've been lathering in Vicks. It's like me and the Vicks bottle are best friends right now. Yep, I've been doing lots and lots of that. You know what is so funny about Vicks? I have an old bottle because, listen, Vicks seems to last forever. I have an old bottle that I swear in my head is way more potent than the newer bottles that I've purchased now. I don't know if somebody's mixing it differently or this is just psychosomatic, but I'm like scraping at the bottom of that barrel right now of that bottle because I'm like, this one is just so much stronger. When I put it on, I really feel it like extracting everything. And the newer ones don't quite seem to have the same intensity. So Maria says it'd be interesting to know how many persons in Cayman got corona after being vaccinated. I don't know. I mean, I know we've got total numbers. I don't know if they have it divided up by that anymore. The numbers that they really are watching are the hospitalization numbers. So last week, I think we had like 9 people who were hospitalized. And of that, something like 8 were unvaccinated. Of course, with the new variants that have come out, especially with this latest one, you know, your vaccination status is not going to protect you as much from catching coronavirus, but it does still seem to help for the, you know, for the serious complications. And of course, now we have viral medications that can be taken. So let's talk about that for a minute. You guys know the United States president recently contacted COVID. He's quite old. He's like in his late 70s, right? Or pushing it. I don't know why they allow presidents to be so old. Like, I think at some point they might have to start capping an age in the US, because even Donald Trump, how old is Donald Trump now? He's at least in his mid 70s. He's not the healthiest person in the world. And I know that he is pushing for another re-election bid in I think it'd be 2025. And people are very, very concerned about that. But you know what? I'm not trying to put my goat mouth on the man, but if he's even alive for 2025, I would kind of be a little bit surprised. His poor first wife just died the other day. She fell down a set of stairs, it looks like. I don't think the final coroner's report is out. So I'm not sure if she had like a cardiac event before falling down the stairs, which is entirely possible at her age. They said that the stairs were always very dangerous because they were kind of like windy, and everybody was like, oh, these stairs are going to kill you one day. And sure enough, it did. But so the president of the US has contracted COVID, and he's taken an antiviral called let me just see here. What's his name again? Joe Biden, the 48th president. No, he's the 46th president, sorry. So they're saying that he likely has the BA.5 variant, but his symptoms are continuing to improve. And he has taken, let me see which one of the antivirals. So he has sore throat, rhinorrhea, loose cough, and body aches. What else does he have? So this is according to the White House physician. So he took Paxlovid, which is a Pfizer antiviral pill that can reduce the risk of hospitalization for COVID-19 patients. And they say that you want to take it early on. So these antiviral pills, help you stay out of the hospital essentially, and hopefully help you remain alive is the reason why you're taking them. So this particular variant, the BA.5, is now responsible for 70 to 85% of all US infections. So they're just assuming that that's probably what he has. So he was fully vaccinated, and he has received 2 booster shots. So he tested last week, Thursday, positive, and has reported very mild symptoms. But again, for a man who is in his 70s, obviously age alone, he's 79 years old. Obviously age alone would be a concern. Going back to the whole question of age, even Trump and his family have a history of early onset dementia. And this is just a fact. And so even though Trump is in his 70s, one has to recognize that maybe some of his behavior and some of the things that he does and says is legitimately because of this family history of early onset dementia. Just like with Ronald Reagan. Ronald Reagan was having cognitive issues long before he was out of the presidency. And I think some people are trying to cover up for that. And, at the time that it was happening, my apologies, maybe it wasn't quite as obvious, but as the years went on and after he was out of office and people are much more willing to speak the truth about these things, they were like, yeah, the guy was forgetful, and, the wife was helping him, and oh my goodness. And other people were helping him along the way. They got to think about putting a cap on the age. So Biden is actually at the age of 79, the oldest president to ever be inaugurated. And, sometimes he kind of misspeaks and stuff as well. And a lot of that is age. Like when you're in your 70s, your speech isn't going to be perfect. You're not always going to remember the details of all this stuff. You're supposed to get up, and although people try to prep you and they give you talking notes and whatever, you will misspeak and you will confuse words and say stuff. And I think, again, maybe they need to start looking at capping the age of the US president. I mean, they've got enough people where it shouldn't be that big of a deal if they say, okay, retirement age, 65, you can't be president anymore. But child, these old people, they're the ones who are always trying to grab some power and get in. So yes, he's taken this antiviral tablet. I don't know what the number of facilities here are that have it. I think some people do have it. I don't know if they have this particular one because there's a couple of them actually on the market. The thing that I find so interesting about the antiviral pills, and they've proven to be highly effective, by the way, is that a lot of people have been really, really silent about them. Like a lot of the anti-COVID, contingent who were up in arms about all sorts of stuff, they have really not said much about the antiviral pills, which, by the way, are made by the exact same companies that made the vaccine. So Pfizer makes one. Let's see who else makes an antiviral. So, you've got to do some research on this because they say that Paxlovid is being underused due to doctors' misconceptions. This was in the Guardian newspaper. But at the same time, it's not a drug that is for every single person. So there has to be a discussion about, when you should use it and when you shouldn't use it. So there was a study that came out in Forbes magazine. Let me just see here if I can get access to Forbes. All these online publications, child, they want you to pay for stuff. I tell you. Everything. They're like, pay for this, pay for that. I'm like, listen, I ain't paying for it. Now, some of them you pay for because they're actually worth the money. So let me see if I can get this one. So Forbes did a study where, our story where they're saying that the experts are actually saying that it is a good idea to take an antiviral. I'm already subscribed. What are you talking about? To take an antiviral, even if, you, one second here. Let me see if I can pull this up. Let's see if we can pull this up here. Forbes. All right. I'm sure I subscribed to Forbes already. Yes, I have an active subscription. Why are you harassing me? But basically the headline was saying that you should consider taking an antiviral because the earlier you take it and the infection, so COVID patients should take an antiviral even if they don't have severe symptoms. So you don't want to wait until you have severe symptoms. Sorry, you want to try to take it as early as possible because that's when it actually will assist and will help you. So, yeah, what a mess. All right, let me just see. Some of you are sending across some stuff here. I'll try to get this article because this is a very interesting article in terms of this antiviral and why you should take it early on. The earlier the better, in fact, is what they're saying. Because the window of it being effective is quite early. Yes. So lots happened over the weekend. So let's do our Monday rewind here section in just a minute. So I signed up for Forbes and it's still telling me that I'm not signed up. What? Get it together now. So, everybody's trying to do a paywall for you to get news. I must say that on the face of it, especially with local media, there's not a whole lot that I've found that I would ever want to pay for. But sometimes in the international front and overseas publications, it is worth the investment, because they do real deep investigative research pieces. So I think I do like the Wall Street Journal, I do Forbes, there's a couple publications, I do the Miami Herald as well. There's a couple publications that I actually subscribe to. So I think I've subscribed to this one already. Okay, so I'll sort that out a little bit later on. And they always want to know, what are you interested in? I'm like, I'm interested in everything. Just tell me all of it. Food, hospitality, marketing, venture capitalist, Forbes women. Yeah. Just give it all to me. I want to read it all. Tech and innovation, politics and policy, personal financing and investment. So over the weekend, I was listening to a very, very interesting piece I was listening to a very interesting piece on TED Talk about finance, and everybody's having challenging times right now with their money. And this was about women in particular who had certain experiences with money. And it was so fascinating. It was on Saturday morning, and I couldn't not listen to it. It was just such an amazing bit of information. And I want to share some of it here on the program, but it is quite lengthy. So I think I'll break it up into manageable bite sizes, before we just maybe 10 minutes, and then we can talk about it and so on. Yeah. But it's very, very, very interesting. I thought it was something that we can all learn from, about how we treat money, how we handle money. And a lot of it, of course, has to do with how we were raised with money. Like, some of us have a very nonchalant, carefree attitude about money because our parents pass on to us. So Damon says, Dr. Google. Okay, so Zambula wants to talk about CAYS Foundation. All right, no problem. Let's do that next. Miss Lucia says, good morning, Sandy. I enjoyed the Cayman Parliament a few days ago, but I'm not going to Finnegan to buy new speakers. It make me laugh. I love you all at home. Stay safe. They said Bill Gates want to kill us, but I took my vaccine. I'm still alive. Listen, if Bill Gates wanted to kill us, there would be so many more effective ways of doing so than trying to get y'all to take a vaccine that y'all are going to think is being used to kill you. That's like the worst. It would be the worst way of trying to kill someone. If he wants to kill you, just put it in a burger and you never would question it. Y'all be at Burger King, which I love me a burger every once in a while. So I'm not knocking it. I'm just saying that there's so many more effective ways of trying to get, if someone wanted to poison you, just poison the groundwater, because you never test the groundwater, even think twice about it. Y'all drink it, you shower in it, the whole nine works, the whole 9 yards. So good morning to Ms. Nancy. Marshall says, since COVID got here, there's so many self-proclaimed doctors and scientists. It's crazy. I think what it is, Marshall, is for the first time ever, like in our lifetime, we have had a pandemic. Like I am in my 40s and I've never lived through a pandemic before. So this is all new to me. And so it's all new to the vast majority of us. And because of the technology and where things are at, everyone became a Dr. Facebook, a Dr. Google, a Dr. Instagram or whatever. And so it really allowed us to see, and it allowed so much misinformation to quickly spread amongst people that for the first time in our lives, we didn't trust doctors and we weren't relying on the experts anymore. And there's I listened to a whole NPR thing on this. It was so fascinating to hear why there has been a distrust of the medical profession. Some of it is legitimately their fault. Like, there are things over the years that they've not done a really good job of. So even last week, there's the first case of polio. I don't know if you guys heard this. First case of polio in a really long time in, was it New York or California? So first US polio case in nearly a decade is being reported in New York. And a lot of this, folks, has to do with the fact that, people I subscribe for this already? Why does it tell me to subscribe again? I could swear I subscribed already. A lot of this has to do with people not trusting vaccines in general. And this whole anti-vaccination movement isn't something that has just crept up. This has been going on for a really long time. And so much so that, in fact, they have had to, social media platforms for years now have been having to cut off people's access to certain groups and stuff, because they were out there telling people, inject your children with bleach instead of getting a vaccine, because the bleach is going to protect them against polio and all this other stuff. And it's just the level of craziness that has existed isn't new. It wasn't as widespread as when this particular pandemic hit, right? The coronavirus. But there's been an underbelly and an undercurrent of it for a very, very long time. And a lot of those same people were able to jump on the coronavirus and the COVID-19 situation and continue to perpetrate their myths. So a lot of these same anti-vaxxers, they've been around for a long time with other stuff. And you may not have heard about them and you may not have been paying attention to them, but they were there within these fringe groups. COVID allowed these fringe groups to go mainstream. So all of a sudden, a lot of people were willing to buy into all this nonsense because they were afraid, and the coronavirus was different and we didn't know where it came from. And we had suspicions about, did the Chinese develop in a lab? What kind of work have they been up to? I mean, it's just a whole plethora of stuff that made this whole situation ripe for the picking when it came to people just jumping on it with all sorts of misinformation. And it's really, really unfortunate, I think, because there are people who've lost their lives as a result of not doing what they needed to do, even right here in this community. And when those people died, nobody wanted to take accountability for the persons here that, were spreading misinformation, and those people were believing it. They were taking the ivermectin. They went and got their prescriptions from certain physicians who shall remain nameless on this program, but they know who they are, and they still ended up dying. And these physicians claim that they have all sorts of data to support what they claim is their conclusions that they've already drawn. And to date, we've not seen any of that data. It's not been peer reviewed or anything of the sort. But you all, like a bunch of fools, were sitting down there believing these local physicians about what they had to say about the coronavirus and stuff. And all I could do was just shake my head. Now, some of you have lost your mother, an aunt, a grandmother, because they were buying into this ridiculousness. And it's just so incredibly sad because, had they not stayed home taking ivermectin and gotten to the hospital in time, there might have been some hope for saving. And I'm specifically thinking of at least 2 individuals who refused to, take any proper prescription and refused to go to the hospital. Ivermectin was not cutting it, folks. I'm sorry for you, but those people are now dead because of it. And the logic that we use is, oh, well, I got COVID and I'm fine. I'm just like, okay, that's not very scientific now, is it? There's a lot of people who got COVID and are fine. There's a lot of people who got COVID and are not fine. And they have long haul COVID and they have diabetes and cardiovascular disease and all this other stuff. When you speak from your own position, or like the 5 people that I know that got COVID all said it was nothing worse than, a little cold and whatever. That's not research. That's not empirical data. That's not a double-blind test of 500,000 people or more that you can say, okay, these are the trends and whatever, right? So I'm just very, very cautious about, what I see happening in the world around us and how quickly people are willing to accept misinformation. And a lot of it was driven by Trumpism and his position and all this stuff. I mean, this man was legit telling y'all to go drink bleach and you're going to be fine. Somebody, this is a little bit of a joke, but I saw on Instagram over the weekend, someone said, I need a girlfriend who is like a Trump supporter. She's not going to believe anything anybody says about Trump. So when people roll up on her and they're like, oh, your boyfriend's cheating on you. No, he's not. Oh no, he's loyal to me. And it's like this blindness that comes with being a Trump supporter, and the way that the comedian had fixed up the wording whenever it was like super funny. But the undercurrent is that no one should ever be in a position where you blindly accept and believe every single thing that they say. It's just like, what on earth? And unfortunately, again, America is in a very precarious situation these days where, I don't know, man, they just, and it's not just America, it's a lot of Europe and other places. They've gone so far. I don't know whether it's left or right, because I don't keep track of those trends. Like, they don't mean anything to me, left, right. To me, it's just like they've gone so far stupid. That's all I know, right? And the, the insurgent, the was it January 6th thing, which is still being investigated. Charges might flow from that. It's just unbelievable that America has gone down so much. As someone who's lived there for 15 years of my life, and I love America, but what I see happening in the last probably 10 years has been very, very disturbing, and lots of disturbing trends. And, this is a country that was built on the back of slaves and continues to have a lot of issues as it relates to race relations. And it is what it is. Celine says, my sister and I have the same thing. The old Vicks is more potent than the newer ones. And we have an old bottle and a new bottle as well. Well, it seems like they last forever, I must say, because I've had this bottle for years now, child. It just keeps going. It's like a bottomless pit of Vicks. I keep digging it out and there's still more. So yeah, I'll use it till there's no more, I guess. So Olive says, I got COVID twice after I was vaccinated. Thank God I was vaccinated. My journey both times with COVID was not bad. And she's thankful that she got vaccinated. Damien says, at least do a pre-psychology exam. It's done to join the military. Well, I don't know if everyone in the military does it, but I think there are certain institutions that make you do these psychological tests. Imagine if we had to do that for our elected officials. Woo. What a mess. So Jonathan says, how come we not getting none of these pills for prevention instead of a shot? Well, they're not for prevention, Jonathan. So let's be very clear what we're saying here. The antiviral pills is once you have it, they will assist you in not having as bad of an infection of it. So they don't prevent COVID. So be careful, because the devil's in the details, exactly how you say it. Yeah. So no, it's not about preventing COVID. Nothing is going to prevent COVID except social distancing, washing your hands, and mask wearing. They help reduce the potential of you catching COVID, but they're not going to prevent it. So once again, nothing prevents COVID, not even the virus, or not even the virus, not even the virus either, but definitely not the vaccine. What will prevent COVID is certain behavioral things can help. But even those, folks, you've got to be mindful of the fact that, there's no such thing as prevention of COVID. So you do your best to not get it. But if you get it, a viral pill will assist you in not being hospitalized and seriously ill. And there's a number of them. Let me tell you which ones are out there. So there's Paxlovid, which I think is the latest one. So that's an oral antiviral pill that can be taken at home to keep high-risk patients from getting so sick that they need hospitalization. So you get that by prescription. There's also molnupiravir or something. So that's another one that was available earlier in the year. So remember now, in December of last year, the FDA approved the first oral antivirals, that's a pill, for the treatment of COVID-19. And I want to say that, let me see. Now, there's a couple of them that are out there. And you need to get this from a physician. So mild to moderate COVID symptoms. So Paxlovid got emergency use authorization back in December, the 22nd of last year. And then the next day, emergency use authorization was given to Merck's antiviral pill, which is called molnupiravir. hold on now. Molnupiravir, I think is how it's pronounced. So that's at least 2 that are available. And again, they can only be given to, like, you got to be over 12, at least 88 pounds, high risk for COVID-19, for developing severe COVID-19. And one of them, so how they work is they actually reduce the viral load, which can help reduce symptom severity. And they are quite different, apparently, in terms of how they work and how they're administered. So I'll give you guys a link here from Houston Methodist, where you can read up on the differences between those two. And of course, they come with side effects and stuff as well. Muscle aches, high blood pressure is a side effect of the Paxlovid. So, you've got to be carefully monitored by your physician. Increased sense of taste, diarrhea, dizziness, everything comes with a side effect. So I'll put this in the link section for you. You can go and read up on those 2 if you'd like. All right. I don't know what color they are. Sorry. Good morning, Damaris. So good to see you. By the way, 936-2626 is the telephone number. If you guys, what happened to the phone again? Is my phone dying? I think the phone is like having some issues. Feel free to call in if we can get the phone working. Don't know if the phone has died or what's going on, but I had it in charge. It just doesn't seem to be charging. So it says Apple Restore. What? Oh no. So it looks like this phone legitimately died. Like something happened to it and it's asking me to restore it. Oh, honey child. I mean, I got time to restore the phone this morning. So I guess if you were trying to call, that might be one reason why you have not been able to call. I'm not sure what happened here, but it's asking me to restore the phone. Well, you know what? This will be a Marlon job for later. So I'll let him know. I'll message him right now. Yeah, put this on your list of things to do. I'm not sure what happened to the phone there, but anyway, yeah, that's too bad. Well, we can do, as a backup, let's do the other phone, 324-1612, if you're dying to call in this morning. 324-1612 is that number. Let me actually just connect it to the board while I'm at it. Yeah, that's weird. No clue what happened there. Let me put this in discovery mode. Give me 1 second here, good folks. So we got system, Bluetooth, search for audio devices. There we go. Connect. Okay, so pair. All right, 324-1612. That number is now paired if you want to call in as well. Good morning to Debbie. Says, morning, Sandy. Hope you feel better soon. I hope the idiots who killed those poor baby chicks are fired and convicted. Yeah, I mean, it was an accident, obviously, but still, someone needs to be held accountable and they need to figure out what happened and, so it doesn't happen before. Everton says that beautiful flag behind you needs to be straightened out. It looks crooked. It's actually not the flag that's crooked. It's the camera that's crooked, believe it or not. So the entire wall, it's just that the flag makes it very obvious. The entire wall is actually impacted, but it's the actual camera itself. But I can't quite see. But for some reason, the stand that it's on, the camera is a little bit too heavy. Everton's like, respect that flag, girl. I know. Got to respect the flag for sure. Shirley, thank you. Jonathan says, some of it, most deaths are caused from medical malpractice. They're still waiting to see what's going to happen in long term. Most deaths are caused from medical malpractice. Okay, I don't know. I don't know where that information is coming from, but that's not true at all. Medical malpractice does not account for most deaths at all. You got to be careful when you use terms like most and everyone and everything, and because for the most part, those things just don't hold water. They're not true at all. So, Jonathan, I don't know what you're talking about when you say most deaths are caused by medical malpractice. That's just not a true statement. And I'm not sure how you could think that. So, Damien says, well, it's like the same fools who were soaking tampons in vodka, licking toilet bowl seats, and so on. Yeah, the level of craziness is quite interesting. Why didn't they investigate the BLM riots? They did way more damage. Again, I don't know that that's necessarily true, but when you have people storming the Capitol building in your country, that's a lot different than someone protesting out on a public street. And I don't know when you say cause more damage. I mean, the storming of the Capitol has undermined the entire faith in the American system. You had legislators who were literally running for their lives and coming within feet of people trying to potentially kill them. And more importantly than that, you had a president who not only saw nothing wrong with it, but by all accounts was encouraging this insurgents and encouraging violence because of his fake belief that an election was stolen from him when there was absolutely zero evidence to support that. So much so that his own daughter has broke rank with him on this. His former vice president has broke rank with him on this. And, there is a bigger question about what happened. Secret Service agents' messages have gone missing. Like, it's just, when you think about it, it really is quite astonishing what has happened. So if you compare that, Damien, to the Black Lives Movement, the two they're not even remotely connected in terms of the amount of damage to the American system that has happened. Physical damage as well, but like the undermining of everything that you believe is supposed to be democratic. Like, how do you have messages off of Secret Service phones that go missing? How do you have a president who is involved in this? Like, it's just unbelievable. I'll give you a timeline from BBC where you can see some of the events and how they unfolded. Brenda says, Sandra, call it what it was, an attempted coup. I mean, yes, there are people who are saying that this is treason at the highest levels. Oh my gosh, it was it. In that moment, as it started to unfold, literally as someone who, was an American resident, I don't know. America has fallen from grace if there ever was such a thing. But let's be honest about American history, right? America has always been a country that was full of vagabonds and lawbreakers, and that's really what America was built on. Like I said, on the backs of slavery and all these other things that no one in their right minds would ever support. So I don't know. It's just horrible. Sometimes I think to myself, would I ever move back to the States? And right now, in this moment, in this time, the answer is unequivocally no. It's a hell no. Like, I go there for a couple of days of shopping. I'm ready to get out. I'm like, get me out of here, because I don't know when the next shooting is going to happen. There's more shootings over the weekend, as you guys know, more people killed. There was a case, I don't know if you guys know this, last week, where a man was being robbed at the ATM. Trying to prevent the robber from robbing him, he shoots the robber, except innocently shoots a kid instead of the robber and killed the kid. And they've decided not to press any charges against him for the death of that child. And the family is really, really upset about this. And so even this concept of, we're all carrying guns to protect ourselves, doesn't really work out too well for them because you're killing innocent people while you think you're trying to protect yourself. It has just gone absolutely berserk. Ms. Brenda says it makes Watergate look like an argument in the coffee room. It really, really does. And Damon says they have any proof of that against Trump. Well, that is why they are in the process of carrying out all of these interviews. And if you've been following it even remotely, Damien, you will, of course, have already concluded that the president, through his tweets and other things, and even what he was doing in the break room, the things that he was saying, he was encouraging exactly what happened to happen. I mean, I want to show you guys a picture here. Because like I said, this breaks my heart for America. Like, I never thought America would go down this path. But here's a photo of security official guards at the entrance, guns drawn, right? Trying to stop people from coming in, trying to stop these protesters from coming in. And there were, legislators and other people like literally hiding underneath desks, and they thought that day that they were going to lose their lives. Look at this. In the Capitol building, gunshots fired, and this man is sitting in the speaker's seat. I don't know how you can compare this to the BLM movement at all, Damien. I don't think that there's even a remote connection to the two. This is, to me, beyond anything that should be accepted. So a lot of them now have been arrested. Some of them are going to jail. They're all over the news crying about how, we didn't know what we were doing, and we were just following Trump, and now we regret it. There was 2 that were convicted, I think, last week and sentenced to jail terms. And they're out there saying, this left people dead. But they're out there saying, we're so sorry. We didn't realize how crazy we had gotten, how we got caught up in the whole Trump thing. And it's like, really? Really, America? Oh my God. Anyway, the more I think about it, the more it just, brings me to tears, to like literal tears, where America has gone. It's just really sad. But, at least some people are being held accountable, the ones that they can identify. So they have a whole list of people. 882 people have thus far been charged in the Capitol insurrection. And they have a whole table of who those individuals are and what they're charged with. Everything from assaulting, resisting, impeding certain officers, using a deadly or dangerous weapon, carrying a pistol without a license. I mean, it is just unbelievable. 329 federally charged writers have entered guilty pleas so far. And the FBI keeps pouring through video footage, social media posts, phone location data, and tips from the public in order to identify more individuals. All right. Everton says, I tell my children, which they're all grown, whenever you go to Walmart, make sure you wear a helmet. And that's what's going on now in the States, in the restaurant, the bars, everywhere. People break out in a fight. It's crazy. Not even a fight, like just a shooting incident. Dane says, feeling hurt for the innocent child's families. Yeah, it is. It's just, you don't feel anywhere safe anymore. I can tell you that one thing. Brenda says the DOJ is not lacking evidence or proof. Question is, are they going to indict him? Well, we will see. I mean, that is definitely, there was another story I was listening to last week in NPR about the difficulties of indicting a sitting president or even a former president. And so they've got to cross all their T's and dot all their I's, Miss Brenda. But I think every single day that we find out more and more about what transpired, it's probably only a matter of time. Miss Celine says, preach it, Sandy. It's very sad to see what's happening in America today. Everton says, but the funniest thing about it is all these people that encourage those individuals to do such a crazy thing did not help them to pay their legal bill. So a lot of them are in trouble and bankruptcy because they've been stupid to drink such Kool-Aid, and now they're paying the consequences. So, yes, very, very sad. All right, let's go ahead and take our news break. Kevin's got some news for us this morning. And then after that, let's come back and talk about CAYS Foundation. And this is something that concerns us here locally in the Cayman Islands. What is happening at CAYS Foundation? Only God knows. I do not know, but that place needs a real cleanup. So let's talk about that when we come back after these messages.
Hello, I'm Kevin Watler, and this is your CMR Daily Buzz. An emergency meeting has been called by the Department of Environment to go over the soy gassum issue and determine what remedies can be implemented to address the problem, which has been affecting many coastal communities across all 3 islands. Most recently, parts of the western edge of the North Sound have been affected by large amounts of soy gassum seaweed, which primarily came ashore in the Sound on Saturday. Be sure to watch The Cold Hard Truth with Sandy Hill on Thursday. A soy gassum expert will be on the show at 9 a.m. to answer your questions. Chris Ann Harris, who is a care worker at the Francis Bodden Children's Home, is being accused by residents of assaulting a 13-year-old at the facility and giving her a busted lip. Despite these serious allegations, the police have shared that they have no reports about the incident, leaving many to wonder what reporting protocol was followed. Teen residents reached out to CMR and shared that the incident, which took place last week, has not been properly handled. Their version of events is that the worker was staring at the teenager, which made her uncomfortable and prompted her to ask why Harris was looking at her in that manner. The teen then coughed in her face, which resulted in Harris hitting her, busting her lip, and then restraining her on the ground. Now, the teen also sustained injuries to her fingers, and no professional medical assistance was provided to her, nor a welfare check was conducted. Now, while residents shared that police were called, the police have confirmed there is no report on file. In a separate incident, the police were called after a staff member locked out a resident. The Bodden Town Police Station went to the location and attended the scene to document the incident. And in other CAYS Foundation news, CMR understands that the Bonaventure home is closing and the male residents there will be relocated to the Francis Bodden location. Now, Jennifer Leach Tippett, the manager at the home, has recently tendered her resignation effective July 29th. According to correspondence she sent out to staff, she has a new and exciting opportunity working in the private sector. Leach Tippett makes no reference to the closure, but instead shares that a recruitment exercise should start soon for her replacement. 28-year-old Javon Dixon, who is accused of killing his friend 32-year-old Joven Omar Fuentes earlier this month, pleaded not guilty to murder when he appeared in court on Friday. Fuentes was gunned down near Gun Square Road in Bordentown on July 1st as he sat in a car. He was rushed to the hospital where he was pronounced dead. Eyewitnesses identified Dixon as the shooter, and police apprehended Dixon several hours after the shooting. Dixon appeared in court by Zoom at Her Majesty's Prison Northward, where he is being held. A trial was set for the end of January 2023. A loggerhead turtle was poached from a beach in Cayman Brac as she came up to nest Wednesday night. The Department of Environment said the Cayman Brac loggerhead numbers are close to extinction, estimated at less than 30 mature nesting females. Now, losing mature nesting females to poachers is one of the greatest threats facing this population and may lead to their extinction. The loggerhead sea turtle is a Part 1 protected species, meaning it is protected at all times under the National Conservation Act. Now, the public is asked to report the suspicious sale of turtle meat or eggs to 925-3647 or 911. 25-year-old Charles Leonard Walton III, who was arrested by the police after he was listed as wanted last December, is again wanted by the police. Police told CMR that in January, they issued a wanted bulletin for him, but it was due to a matter that was before the court at that time. However, that matter has been completed in the court, and he has since been released from custody. Police added the current wanted bulletin is in relation to a new matter and that he is wanted for firearms offenses. A police statement said he is known to be violent and is believed to be armed and dangerous. He is approximately 6 feet 4 inches tall with dreadlocks and was last known to be living in Prospect. Police say he should not be approached and to immediately call 911 upon seeing him. A second man who is considered armed and dangerous is wanted by the police. 27-year-old Luisto Eusebio Hernandez joined Charles Walton III on the police wanted list. He was last known to be living in East End and is also wanted by the police for firearms offenses. Once again, police say he should not be approached and to call 911 upon seeing him. Now, police wanted to remind the public that according to the law, it is an offense to obstruct, mislead, or act in such a way as to prevent the apprehension of a person who committed an offense. If prosecuted under this section, a person may be liable on conviction to a fine of $5,000 or imprisonment for 2 years or both. And now to missing men. While they are not wanted, police continue to look for 2 missing men. 53-year-old Noel Paul Manning has been missing since June 24th, and 26-year-old Adrian Williamson has been missing since July 6th. Police say contact your nearest police station if you see or know the whereabouts of the missing men. Anonymous tips can be provided directly to the RCIPS via their confidential tip line at 949-7777 or via their website. The Office of the Ombudsman has made a decision and clarified the extent to which records of private sector service providers are exempt from release under the FOI Act, weighed against the public's right to know about deals with the government. Now, the decision related to a Freedom of Information request to the Cayman Islands Airports Authority about the licenses, rights, and services at the 2 local international airports. In her decision, Ombudsman Sharon Rolston noted that while there is still some debate as to whether or not the airport is subject to the Procurement Act, which dictates how the civil service acquires products and services, the Act clearly requires that certain information and contracts is made public within a certain time period. The Needs Assessment Unit has updated its eligibility criteria to better serve older persons and persons with permanent disabilities. Going forward, after having previously qualified for NAU assistance, these individuals will not have to undertake a full reapplication process. Instead, the NAU will verify that their circumstances have not changed using a continuation certificate. This policy change will reduce the burden on the people who really need financial assistance. Previously, the NAU required these individuals to engage in a full reapplication process every 3 years. This information and the continuation certificate is available on the NAU website under the Forms section of www.nau.gov.ky/forms. And the Needs Assessment Unit reminds the public of its upcoming district days, which will be held in East End and Northside on Friday, August 5th, Bordentown on August 12th, and West Bay on August 19th. More information is available on the events section of the NAU website. The NAU is also regularly updating its Facebook page. Caymanian golfer Aaron Jarvis is back on the rock. Sports Minister the Honorable Bernie Bush and Chief Officer Teresa Equinici met Aaron at the airport when he arrived back on island. The government representatives congratulated the amateur golfer for his outstanding golfing. The University of Las Vegas, Nevada sophomore is back in Grand Cayman for a few days after his historic performance at the 150th Open. Accompanied by his parents and brother Andrew, the 19-year-old was the first Caymanian and first ever Latin America amateur champion to make the cut at the St. Andrews, the world's oldest golf course. Mr. Jarvis shared that he will soon be traveling to the Western Amateur Championship in Chicago, and from there on to the U.S. Amateur Championship in New Jersey. The golfer will also be playing at the World Amateur Team Championships alongside his brother Andrew and Justin Hastings in Paris, from August 31st to September 4th. Team Cayman swimmers brought back 2 gold, 3 silver, and 2 bronze medals in a large and super competitive field at the Central American and Caribbean Amateur Swimming Championships in Bridgetown, Barbados. Now, the meet gave Cayman swimmers the chance to get official times in a 50-meter pool. Soraya Broadbelt stormed home with a gold in the girls' 13 to 14 50-meter butterfly and 2 silver medals in the 200 and 100 butterfly. Podium places were won by Dominic Hilton, who won a silver in the boys' 13 to 14 100-meter and a bronze in the 200-meter breaststroke. Additionally, Luke Higo won a gold in the boys' 11 to 12 50-meter and a bronze in the 100-meter to add to the team's 7-medal haul. Now, Cayman's open water team competed in a field of 80 to swim the 5 and 10K races with a day's rest in between. Now, despite never having swum a competitive 10K race before, they did a great job battling the current and staying hydrated. This was the first time Cayman had sent a dedicated open water team, and it's part of the CI Aquatic Sports Association's initiative to develop the discipline to its full potential. More information on each of these stories can be found at CaymanMallRoad.com. Now for your CMR weather update is brought to you by WG Charters. Sunrise at 5:59. Lots of clouds will be around today. The temperature rises to the high 80s, but it will feel much hotter than that. Some of you may not know this, and if you don't, here's a quick lesson. If the high temperature is 87 degrees Fahrenheit and the relative humidity is at 72%, like what we will have today, the temperature will feel like the mid to high 90s. Now for winds, the winds will be east at 10 to 15 miles per hour and the sun sets at 7:04. When it cools at nighttime, the temperature falls to the low 80s. High tides at 7:33 a.m. and 8:57 p.m. and the low tides at 2:38 a.m. and 2:04 p.m. Looking forward, similar weather conditions are expected. It's summertime, so those hot days and warm nights with brief scattered showers are very typical for this time of year. CMR weather updates are brought to you by WG Charters. They offer private boat trips for a great price, so we encourage you to support them. That's it for now on the Daily Buzz. Thanks for joining me. Please stay safe and God bless.
All right, Kevin, thank you so much for bringing us up to speed there on those stories. I need to ask Kevin about regional stuff. I don't see any regional coverage lately, but that's your daily news buzz. Lots and lots going on. So a couple of things from Kevin's news story. First of all, the sargassum situation is completely out of hand, to put it mildly. And so on Thursday's show, we do have a sargassum expert that's going to be joining the program, who is going to be kind of walking us through, what some of our options are, because again, everyone's like, we can use it for fertilizer, we can do this, that, and the next thing. I think we have some options, but certainly we have to make sure that we, I suppose, know what those options are. So we do have someone who is going to be coming on again, talking about what can be done with sargassum, what it is, and historically, what have people done with it? I mean, there's just so many questions in relation to it, right? So hopefully on Thursday's show, we'll get some of those questions answered. We also have attorneys from Recover Cayman that are going to be coming in. Tons of accidents over the weekend. On Friday, a vehicle caught fire by the Mango Tree and Foster's Airport roundabout. There was a collision, and then shortly after the collision, the car caught fire, like literally exploded into big flames. Lots of questions about how we can make our roadways safer. And of course, if you need legal advice, once you've been in a collision, definitely recover the people that you need to be speaking with. Sorry, so they'll be coming in on Thursday as well. On Wednesday's program, we're going to be doing Caribbean Connection Wednesday. We're going to be talking about crime in the region. So we've got a couple individuals from Jamaica who will be joining the program, including a gentleman who I believe he now lives in the States, but he's a former FBI agent, and he's going to bring us up to speed on some of the elements of crime in the region and how it spills over even onto our jurisdiction here. So speaking of spillover, over the weekend, we received a tip that apparently, the guy that they caught the other day, they say he's a gangster and responsible for at least 3 murders in the St. Catherine area. Our sources are saying the police have said that they're looking for one more individual. Our sources are saying that they should be looking for more than that because there's actually more than that here. Now, the phone started working again, folks. So 936-2626 is a telephone number if you'd like to call in. So yes, this is kind of interesting because I'm like, okay. I mean, I guess at any point in time, we never know who's actually on our shores, which is kind of scary. But, the sources are saying that this guy brought more than one other gangster with him. And so the RCIPS should know that they're not looking for just one gangster, but they are looking for more than that. Whoa. Okay. I'm like, no photos, no nothing of who these individuals are. So a little bit on the scary side there, but we also know that in terms of locals, the RCIPS are looking for 2 men who they say are also armed and dangerous, and 2 men who aren't necessarily armed and dangerous, but they've just gone MIA. They're missing and can't be found. Now, I know y'all are thinking this is such a small island. How can somebody go missing and can't be found? But apparently it's happening. So, yeah. All right, let's talk about the CAYS Foundation. Ms. Brenda was also commenting to Damien's point that they're not anti-Trump people. They're sensible Democratic people who want to continue to live in a free America and not in a dictatorship run and led by an imbecile. There's an impartial view from the outside. That's an impartial view from the outside. What a mess. All right, so listen. We have a complaint that we received from residents at the Francis Barton Care Center, right? Francis Barton Children's Home. And basically, they had been messaging us for quite some time saying that one of the young ladies had been assaulted at the home by one of the care workers. Now, let me just preface this by saying, listen, I don't work there. I don't live at the care center. We can only go based on what information we receive. And for quite some time now, dating back for years, we have been receiving a lot of complaints about that care center. They've had a lot of staff turnover. They can't keep local staff, from what I understand. Either they push them out the door or the local staff just don't want to stay. They don't want to hire locals, even in top management positions. Locals that are well qualified are often pushed aside and looked over for people who are less qualified, right? And this has been happening for the better half of, I'd say, at least 4 or 5 years now. Now, I think that like some other organizations on the island, the CAYS Foundation is constantly looking for who's providing us with this information. Well, they're going to have a hard time trying to crack that nut because the truth of the matter is we get it from all over the place. They're assuming, it must be disgruntled staff and workers. We have had residents, both past, present, and I won't say future residents, but we've definitely had past and present residents who've reached out talking about the conditions in that home and that they have grave concern. Everything from kids who are being medicated and how they're being treated. Kids are suicidal at the homes and at the home, and nothing is being done to assist those young ladies in particular. Some of them are self-harming. They're doing all sorts of stuff. And it's quite unfortunate, but there seems to be no one who can get a grapple on the situation. Teens getting pregnant who are in the care of the home, men sneaking through the windows, having access to these children. I mean, the complaints have just been snowballing, and it's just one thing after the other. Staff behavior, them having sex on the premise, having alcohol on the premise, treating certain children differently because of who they are. We heard that one young lady a couple years ago was in a pageant and she was getting preferential treatment from the some of the workers at the home. I mean, it is just it's shocking what has been permitted to go on at this home. The government, and I don't even know whose responsibility the home falls under in the Pat government, but they have remained shockingly silent on this, to the point where, I mean, I remain very, very concerned about what's going on at the home. And it's just one of those things that nobody wants to address it. So this is the latest in a long list of complaints about the care home. So in this particular case, this young lady, her name is, what is her name? Hold on, let me get you the name here. She is being accused of assaulting a student. Now, again, these are teenagers themselves who are resharing the story. So I can't tell you how much of this is 100% spot on and how much isn't. I'm not there. But Chrisanne Harris is her name. And so the students have said,
the app is now my HSA.
Oh, sorry.
Online. Securely app.
That's the HSA app on the website. All right. So it appears to be a situation where some sort of incident happened with this young lady and one of the teens who's like 13 years old. And it is alleged that the 13-year-old teen may have coughed in her face or done something. And then she responded with a fight and altercation that transpired, and the teenager ended up getting a busted lip. Now, some people, I saw someone message me this morning and says, oh, there's more to the story. You need to dig deeper. There's only so deep I can dig if the authorities have not even investigated this, which I find absolutely shocking. It's not for me. Like I said, I don't live in the home. I can't go there and say, okay, I'm here with my detective notebook. Let me try to figure out exactly what happened. Let's take eyewitness statements. All I know is multiple teens are saying, hey, Miss Sandy, this is what happened. Yes, the young lady was being rude and she might have coughed in her face and whatever. But what happened then is the young lady ended up with a busted lip. No medical assistance was called for her. And they just, dabbed it with a piece of cloth. And the police, we reached out to them. They know nothing about it. And this is where I have an issue. If an altercation has occurred, and if a young person is then injured as a result of that fight, there has to be some independent agency, independent of CAYS Foundation, independent of Francis Bodden Children's Home, that carries out an investigation to see what is going on here. What happened? Get witness statements from the staff, the other teens that are in the home, everybody, and draw some sort of a conclusion. But when I reach out to the police and they say that they have no report of anything that has gone on, and they don't even know what I'm talking about when I inquire, well, there was an incident, a physical altercation, blah, blah, blah. They said, well, we don't know anything about it. How can that be right? Okay, how am I supposed to dig any deeper when the police have not been called? It makes no sense. And the CAYS Foundation should have certain protocols in place, folks, where as soon as some sort of physical incident happens at their location, the police are called and a report is made. A child ended up with a busted lip. That's enough to call the police. MASH unit should be involved. A proper investigation should be carried out. So there are people who are defending this young lady, and I'm not saying that they shouldn't defend her, because again, we may not have all the details, but what I have are a lot of unanswered questions, a lot of concerns about why there's not a very specific protocol that would be carried out in relation to children. So if she was in the right, and she may have been, why are the police not the ones that can say that? Why is the MASH unit not the ones that can carry out an independent investigation and come to that conclusion? That's where my question lies, right? So I'm not, listen, a young person coughs on you, that is disrespectful, and they certainly need to be punished. Does that mean that they need to be punished with a busted lip? I don't think so. I don't know what else ensued after the young lady allegedly coughed on her. But the residents who live in this home are concerned about their own safety. And they're saying that there is a lot that is going on at that home that no one is being held accountable for, and that they're being treated less than human. Yes, these are problematic young people. They have issues, they have problems. Yeah. Some of them are violent teens. Some are not violent teens. And to this day, I don't know why they're mixing the two, but this is what our so-called experts have decided to do. You know, some are in the care of the Francis Bodden home because they're victims of abuse. And we're putting them in there with juvenile delinquents who have behavioral issues. And we're mixing the two, and somebody thinks that that's a brilliant and smart idea. This is a recipe for continual dysfunctionality and problems. And it has only just begun, although it's been going on for years. And every time we bring it up, there are questions to be asked. No one has ever sufficiently addressed the questions. They've never made any statements. They've never even admitted. Well, I think at some point when we first brought this up, the initial report, maybe back in 2019 that we did, there was some confirmation that an investigation was being directed. This was November the 25th of 2019. CAYS Foundation under investigation as whistleblower placed on leave. So the whistleblower at that time has since left the organization. We have heard nothing at all about the outcome of this so-called investigation. And yet there were serious concerns about who was managing the facility, how they're managing it. Listen, folks, I sat in a court of law. And I saw former CAYS manager, Sidney Williams, basically say that, you know, he was there doing certain things, but it was the ministry's responsibility. This was after poor Risco, what was Risco's last name again? Risco Batten, I think was his name, had drowned while in the care of a government facility. And they had certain workers charged criminally for that, when they should have had Mr. Sidney Williams on the line for criminal liability. But of course, he already had left the jurisdiction, right? You know, there were questions in relation to his hiring practices. The man hired his own wife and put her as a manager at the Bonaventure home, giving her preferential treatment as it related to the shift work that she was doing. And he sat on the stand remotely and said, don't look at me to have policies in place, speak to the ministry. He's like, I was answering to the chief officer, and they never told me that I needed to have a policy in place that said that workers needed to know how to swim. And it was like, really? Is that not, that's crazy. But he sat there and threw the ministry under the bus and said, I have a boss for a reason. I have bosses for a reason. And if they didn't find anything wrong with what I was doing, then don't be asking me those questions, is essentially what he was saying on a stand. So right now, the CAYS Foundation has suspended a young lady, Caymanian worker. She's on leave, I think, for the past couple months. They have questions about her behavior. But yet a physical altercation has ensued with a 13-year-old child. And this individual, this young lady here, what's her name? Chrisanne, has not been placed on leave pending a full investigation. Can somebody explain to me how this works? And at this stage, it's probably too late for an investigation because now weeks have passed and no one has been interviewed. And then anytime something happens and the CAYS Foundation is in the news, the first thing they do is they walk around telling the residents and staff, oh, don't talk to CMR, don't tell CMR anything. We're going to wait until another child loses their life in the care of the Francis Bodden home before we do something about this entire situation. Now, sources also shared last week that apparently they are looking to shut down the Bonaventure home and to merge the two homes together. Now, if there was ever a bad idea, this is it. You can't even control what is there right now. How on earth? Answer me this, riddle me this. How on earth are you going to take boys that are problematic from the Bonaventure home, shut down that facility, and co-join them with the Francis Bodden Children's Home? I don't even know where the space is that they're going to find for all this. Are they expanding the Francis Bodden Children's Home? No explanation, no nothing. It just doesn't make any degree of sense at all. And once again, we have politicians, unfortunately, who seem like they are woefully inept when it comes to this particular topic. They themselves don't seem to know what's going on. It's shocking. It really, really is shocking to me. So Katsina says, how did it start? What caused her to cough in her face? Was she provoked? Why the police were not called? Listen, if a real investigation had been undertaken, these were the types of answers and things, in my opinion, that they would be looking at. But of course, I can't answer any of those questions because I simply do not know. Was the young lady just being rude for the sake of being rude? Who knows? We don't know. Why were police not called? Now, there's another incident, I don't know exactly what day this was, where they were being accused, the workers at the Francis Bodden home were being accused of locking out a resident on purpose. And so the Bodden Town Police Station allegedly attended the scene. And we are told that they actually took footage from the location, and their early indications are that this was being done on purpose and that this was wrong. Now, why any worker would be trying to lock out a student? Again, lots of questions there. We don't have any of the answers because everything that is done at that home, there's a cloak of secrecy about it. We only hear people kind of like talking on the fringes about it. And I want to remind you guys to go back to this initial story that we did back in November of 2019, where they claimed that they were carrying out an investigation, and all now we can't hear anything about the outcome of that investigation. And there was a lot in that story, from favoritism, nepotism, all sorts of stuff that was going on, the treatment of residents, how they're being talked to in a sexual way about their pom-pom being fat and all sorts of things. Photos of liquor in this closet that staff were bringing into the establishment. Nobody got put on leave for that sort of thing, right? Workers giving residents and a boyfriend a ride in a private vehicle, the kind of thing that should never, ever happen. And there's no accountability. There are no questions. There's nothing about what reports had been done. As of late, we saw a gentleman who had left, the Jamaican Defense Force without proper authorization, allegedly, also working at the foundation. No updates on that when we broke that story maybe that was a month and a half ago. No updates on that since then. It's just like, what is going on at this home? People who were let go from prison because Miss Sabrina Shern was killed under their watch or lack of watching are now hired to work with more vulnerable people at the children's home. Y'all help me understand how that makes any sense. It's just absolutely crazy. Real Deal says that unit is only in existence for the hiring of expats. They don't give a crap about the children. Well, I mean, there are some serious questions here, Real Deal. I will definitely agree to that. And I don't know why it isn't being addressed. These are our most vulnerable children. They're there for a reason, because they're already vulnerable. And we are potentially making them more vulnerable because of what? I'm not sure if this person's calling to be on the program. Well, let's see. Good morning, caller. Are you trying to get on the show this morning?
Good morning. Not up for on the show this morning.
I'm sorry?
So not up for being on the show this morning, but I do have some information I'd like to share with you about a Facebook post.
Okay, well, you're live right now. So if you're not trying to be on the show, we don't finish until 10 o'clock.
Thanks.
Okay. All right, folks. So remember, you can't call me between 7:30 and 10 o'clock and not know that you're live. Every single Monday to Friday, this is where we're at. We're live. We're on air. Try to remember that, 7:30 to 10. Okay, don't call me confidential information during the show because I'm thinking, oh, you want to come on air. All right. Debbie says, wrong people in management, problem with Cayman. And for the most part, I'm not trying to make this about Caymanians versus anybody else, but for the most part, the people who are there are not Caymanians at all. Management and the workers, none of them are Caymanians. So Katsina says our uneducated government, they have no clue or they don't give a damn. Well, I think that they tend to, again, now they're playing it's a civil service matter. They're playing that card, but they tend to not know how to handle any issues that come up. And, they're like, oh, we can't do anything about it because they're all civil servants. Well, it's a sad day when you have civil servants who obviously don't know what they're doing. They're running amok. They're doing things that need to be investigated and nobody's calling and holding them accountable. That's crazy. Marshall says that's a recipe for disaster to merge those two facilities. I agree. One is a boys' home for a reason. The other one is the females and the younger kids. And why is it being merged? Only God knows. Brenda says maybe she's unwell and needs medical attention. Good morning, Mr. Tommy. Katsina says government doesn't care about these kids because they can't vote. Well, it shouldn't even be about that because whether these kids can vote or not, at the end of the day, they're somebody's children and those people can vote. And it shouldn't even be about voting or not voting. It's like you have to do the right thing by your kids. So once again, the Bonaventure, not so much Bonaventure, although they've had issues, but really the Francis Bodden home is being called into question and a lot of questions and no answers as usual. Debbie says, yes, Sandy, my point exactly, not came at it. Good morning, Miss Ruby. It says if they mix the homes and there's going to be pregnancies, no doubt. Again, none of this has been officially said. We got an email showing that Miss Tibbetts, who is the manager at the Bonaventure home, apparently is leaving. We have had no official confirmation that she has resigned, but we've seen a letter, so at least we know through evidence. We feel pretty happy that that's concrete information, right? She basically said in correspondence sent out to staff that she said, as some of you may be aware, as of July the 29th, Friday, July the 29th, I will no longer be with CAYS as I have a new and exciting opportunity working in the private sector. Well, good for her. Until the new managers in place at BBH, Mr. Wendell and Mr. Marlin will share some of the managerial administrative duties. All resident, medical, education, social, family, etc., will continue to be taken on by Mr. Wendell. The staffing and program schedule will be taken on by Mr. Marlin. They will both be working closely together with Ms. Katrina and Mr. Keith until the new manager is in place. The higher level managerial duties will be taken on by the CAYS senior team, Ms. Katrina and Mr. Keith, until the new manager is on board. I wish you all the best in your future and working with CAYS. Signed, Jennifer Leach Tippett is her last name, not Tibbetts, but Tippett, manager at the Bonaventure home. And of course, she testified during the trial of little Roscoe Batten, who was the 14-year-old who died in the custody. He drowned in the custody of the CAYS Foundation. And again, they all were displacing blame on somebody else. Nobody willing to take responsibility for what happened to that poor little kid. Miss Sue says it's really sad, yes, when nobody is accountable. This is crazy to merge these two homes. Unbelievable. So in her letter, she said nothing about the merging, but our other sources have said they intend to close down the Bonaventure home and merge it. Whose brilliant idea was that? Like, I'm just wondering who came up with that. And again, I don't know who CAYS Foundation falls under. I think it might be Mr. Andre Ebanks, Minister Andre Ebanks. But was this something that the minister signed off on? Did he think that it was a good idea to merge Bonaventure with the Francis Bodden home? And how is that going to work? I mean, the Francis Bodden home has so many issues already. Now you're going to take the young men and put them in the same environment as the young girls, and you don't think that there's going to be a problem? I don't know. Let me take a quick commercial break so I can sort out my coughing here. We'll be right back after these messages.
Crichton Properties is one of Cayman's most trusted real estate companies for over 50 years. We offer a diverse selection of property listings and help our clients navigate the world of buying or selling their properties with confidence. Crichton is a name you can trust with our excellent customer service and family-friendly touch. Contact us today to list your home, land, or condo for sale by calling 949-5250 or email info@crichtonproperties.com. Crichton Properties, a trusted Cereba member.
All right, folks. So Miss Sylvia Wilkes is here. She says working with young people is not easy. You have to have the calling and the passion and willing to serve if engaged to. And of course, Miss Sylvia, thank you for listening to the program this morning. She's one of those Caymanians who has a lot of qualifications, who's applied at the same facility to manage the home and has been turned down, to the best of my knowledge, at least on one or more occasions. So they've said to her that she's not good enough, not qualified enough. Now, we have a new manager there. His name is Keith Boyles. He is the manager, I believe, at, I want to say that he's the manager at Francis Bodden, but they're trying to make him the general manager at CAYS Foundation, which would oversee everything, right? And of course, you know, there have been some questions already about his credentials, even on paper. And people are saying, hold on a second. If we keep hiring people and we claim we want them to have this degree and this amount of experience and whatever with children, are we sure that we're doing such a great job when we're pushing people in positions who, quite frankly, do not have the requisite experience? Well, I don't know. All I can tell you is that these are some of the questions that are being asked right now. So he's the house manager currently at Francis Bodden House. He's from the Greater Glasgow area. And concerns are that, again, his experience, he says that he has worked in the residential childcare area since 2006 and as a service manager since 2014. And he looks after children and young people in an open setting, the secure setting, and supported those in foster care. So he has been, for the past 4 months, working as the house manager at the Francis Bodden home. Before then, he was for 15 years with the Kibble Education and Care Center there in the UK, in the Greater Glasgow area. Now, one of the sort of criticisms of him is that he's not yet acquired a degree in this area. So his bachelor's degree is in leisure management, sports coaching, and development. And he's been, since 2018, he has been, I guess, doing a master's program at the University of Strathclyde. And it says it's ongoing in advanced residential childcare. So people are asking, hold on a second, how does he come in with only a bachelor's degree? Because you can't count a degree that's quote unquote ongoing because you don't have it yet. And they have done this, government has done this to Caymanians on numerous occasions where they will say, you don't have that qualification because you're not finished. They don't even care if you're 99% finished. If you've not completed your dissertation that's holding you back, you still don't have the degree. It is as simple as that. So how can he only have a bachelor's degree in leisure management, sports coaching, and development? Yes, he has experience. He says he's worked at the Kibble Education and Care Center. But yet you can take someone like a Sylvia Wilkes, who has a PhD, years of experience working locally with her children. Sylvia, remind me of what your degrees are in. And yet she's told that she's not qualified for the position, but he is. These are the types of questions that people are always asking. Oh, we got a caller. All right. Good morning, caller. Welcome to the program.
Good morning to you too, Sandra.
Hi.
Let me tell you something. My name is Rhonda Schmidt, better known as Shirley. Everybody know me by Shirley. So
Yes, ma'am.
Shirley. From West Bay. Anyway, I want to let you know that you bring a lot of information to us that we hear about it, and then that is it. We don't hear anything more. It'd be years. And one of the stories that I've been hearing for years and years, the rehab in East End, Breakers, sorry, not East End, Breakers.
Yes.
I guess you know what I'm speaking about. It's
the drug rehab center.
Yeah, yes. Anyway, I understand that people can check themselves in there, which if they have a problem and they recognize that they do have a serious problem, and they check themselves out, but they check themselves and they can walk away from that anytime. Now, I know it has a director. I know they have counselors there, but what kind of rules is that they can walk away anytime? And we've been hearing about this for years and years, and no one has ever settled it to say, well, that is true. No, they do have rules and regulations, and it makes one think, why are we spending our money on this sort of thing when these people are well paid, and especially the staff that's supposed to run the place, and it makes one think like all you do is to work to pay these high salaries, and we get no results. The same thing happens to the boys' home. I live down in Coral Gables, so the boys' home is very, very close to us. It is southeast of us. Some days we don't even hear those kids. It's just some bush. It's not even fence. It's just some bush separating Coral Gables and us from them. We do know that they have a little garden planted there. I haven't seen it for a while because I haven't walked by there for quite a while. We don't hear them some days, but we do understand that these kids are locked in at night with key. Key locked. Doors are locked. Now I'm thinking, suppose it is a fire. Suppose it is any really emergency, like a fire. What are we going to say about that if these kids oh, God forbid, I didn't want to even think about it, are burnt to death or badly burnt, are not going to be shipped off like the poor child drowning and saying they didn't know that they had to have the credentials of swimming. Of course you do. That should be one of the first things.
Yeah.
But we let these things pass, and I'm glad that you have the goal to get on have your own station that people can get express how they feel without you cutting them off or without you asking them questions. It cannot go on in this island because people are getting fed up of hearing, yeah, but he can do something when we elect him. Some of us don't even know who's the minister in charge for these places.
Very true.
And it's sad. I mean, how much more expense is this island going to do to its people? And its people is who have to pay for this. Children, young children being abused, young children being raped. And oh boy, if I had I got the will, I just don't have the permission to say what I would do with people that abuse and rape other children. They wouldn't live very long to tell the story. Okay? It shouldn't be no judge, nor no police, nor nothing deal with them. Let the public deal with them. Sandra, I thank you again. I thank you for the time. And you go on, tell it to us as it is. Thank you again, and may God bless you.
Thank you so much, caller. I really appreciate that. All right, folks. Well, it's good to hear that other people are concerned about these things, because I tell you what, I was not aware, and this is something that we can certainly look into, that the residential treatment center at, it's called Caribbean Haven, there in Breakers, was one in which you could, I guess they have different types of clients where you could check yourself in and out. I mean, that's a whole other topic, obviously. And if someone is suffering from drug addiction, you know, they have to be willing to submit themselves to certain treatment options that are available. And I know the court is very keen. They actually have a drug court where they're very, very keen to work with clients. And when they have people on the drug court list, although they're in court for other criminal offenses, they separate them and they put them separately on the list so that they can have continuity of, like, the same magistrate every single week will deal with drug court matters. So that, like, most files get passed on. Like, when you go to court, you never know which magistrate or judge or whoever you're going to get. And it's passed all over the place for each of the stages of the criminal proceedings, right? But specifically with drug and even family court, they have arranged them in a way so that there is some continuity, so that, for example, Magistrate Foldatz might only deal with drug court matters every single Wednesday. And so those people come before him. They have the facility care managers who come and they report on what's going on. Is this person serious about, you know, the care and getting their help? Have they been compliant? Have they been non-compliant with their treatment program? So I was not aware, but I guess it might not be that unusual for a person, if they have put themselves in the program, to be able to leave the program as well. They do have different programs there at the facility, including a withdrawal management unit, which is a detoxification program. But, you know, people who are addicted to drugs, it is a very, very difficult thing for them to, number one, admit to their addiction, and number two, get the necessary care that they need and to really stick with the program. You know, it's sad. Somebody was speaking to me last week about someone that we know, a common acquaintance, And they were saying, the last time that they saw her, she looked like someone who was on some heavy drugs. And they were just so shocked and surprised to see someone who had been her entire life, a mother of several children, seemed to have always been okay, go down this road of now look like she's on crack or something. And it's so sad, but once you start to spiral down that road, that's a whole other cup of tea, folks. Ruby says, is there not a governing body that exists here to safeguard and independently investigate issues in the children and elderly homes? In the UK, they have one. Not to the best of my knowledge, Ruby. Again, this would be one of the key things that I guess somebody in the ministry would carry out an investigation. But the problem with these investigations, unlike what we see in the UK and the US, right? When they have an investigation, remember the little kid in the UK who was killed, and it talked about how the system failed him, how, the care system failed him. They were not properly assessing the danger that he was in and taking the necessary steps to remove him from that environment and to mitigate the abuse that he was being subjected to at the hands of his own mother and stepfather, right? That ultimately caused his demise. Eventually you get that report. They will carry out a report and you get to be able to hear the findings of the report. In the US, it's the same thing. There was a family who, I forgot how many children they had, like 12 or 13 children or something. And last week I was reading how a report has since come out that said even after they took them away from the parents, put them in foster care, some were adults, but they were being, abused, malnourished, put in cages, like all sorts of crazy stuff. That since then, a report has come out saying that in fact, the system's treatment of these children and adults who were in their care was horrific. And it was not living up to any standards of decency and proper protocol, and even resources that had been made available to them, counseling resources, access to monetary funds while they, seek training so they could get employment opportunities, all this stuff. The system, once again, was failing these people. But at least you had a report. Once you have a report to say, this is what's wrong, this is how, from there, you can then see how to fix it. Here we're asked backwards. No report. So we can't even tell you really what the problems are. We talk around the issues on this program because, yes, we get tips and we try to, find out some of what's happening. But there's a lot that I'm sure that we do not know. Some of these children come out of the home and they tell me how they were so suicidal in there. And we've heard of kids in there trying to hang themselves, right? What do? They just strip down the bed and don't give them any bed sheets. That's their solution. They don't try to understand, why are you suicidal in the girls' home? What is so bad? The kids keep running away. No one has ever said, why do these children keep running? Is it because we just got all bad kids and they're all runners and they all want to run out there and find a boyfriend because that's what everybody assumes, or they're out there looking man, or is there some other reason why they are running from this home? Ms. Brenda says, and the proper medical training in psychology. The Zoe says, well, they all did say that they all have bosses. Well, again, the bosses, and back to Mr. Sidney's point that he made on the stand, he was saying his boss was the ministry. He's like, talk to the ministry, the chief officers of the minister. That was his response to a lot of questions. Why are you asking me? Because they were like, how can you be in charge, the general manager of the CAYS Foundation, allowing workers to take children out in the ocean and they don't even really know how to swim? And they kept taking them from one location to the next because on that particular day, the water was quite treacherous and it was getting worse. And they didn't have the ability to call it like, okay, kids, no more fishing because the water is just too rough. We need to go in. Instead, the care workers who were trying to do something good for the young people and give them an outlet, and they really enjoyed fishing. The young man really enjoyed going out fishing, live some kind of normal life. They're like, well, let's just move them to another location. And poor little Roscoe, 14 years old, get in trouble in the water and drowns, and nobody was able to save him. So Jonathan says, it sounds like a case of them trying to save money, and that's going to backfire on them big time. Well, I don't know why they're closing the home because, again, they've not said anything. This is information we're getting from other sources. Miss Darlene Manzanera says, I see Miss Sylvia Wilkes' comment and how I wish she was not in that position. Well, they keep turning poor Sylvia down. Like I said, even on the face of it, on paper, for people who are less qualified. Miss Vernita says, give Miss Sylvia the job. She's been working on her backside for 4 years for free. Marshall says, only then will these young girls get pregnant. Like, I don't know what the plan is. Like, I'm still waiting for someone to divulge exactly how this is going to work. Miss Sue agrees that Miss Sylvia is the best person for the job. The other Darlene McKenzie says, our boys' home in West Bay years ago housed our girls and boys. It was called the Marine Institute. Our children went on boat trips daily, learned how to operate the boat and scuba diving. Now, Miss Darlene, let me ask you a question. When it was the Marine Institute, and this is something I just don't know. When it was the Marine Institute, was it a situation where they were actually living at the facility at that time? Or were they just like there during the day? I'd be curious to know exactly how that facility was set up at the time. Katsina says, the CAYS Foundation's anti-Caymanians, it's for expats. Well, all I can say is the people who have operated that foundation for a number of years and the people that they hire are 99% non-Caymanians, including right down to the very chef. Our poor children can't even get a Caymanian cooked meal because they're hiring everybody but Caymanians to do those positions. I think they might have had one or two Caymanian care workers, but by and large, mostly Jamaicans. Some came in from the prison system, which you can imagine. The difference between the two is very different. You're not supposed to be treating them like prisoners. And a lot of nepotism, husbands and girlfriends and casual sexual relationships with each other. So that's how you got promoted at the CAYS Foundation. Y'all need to go check it out. Like I said, the story's there if you're interested in reading it. Ms. Ruby said, this is true, Sandy. Does anyone even check references on the expat CVs? Because I don't believe it happens, and you could probably find out a lot of information people don't share. Well, you know, I'm sure there's some level of it that happens, but not as much as should be. So even for the gentleman who deserted, allegedly, the forces in Jamaica, my sources said that CAYS Foundation, because he came here as a security guard and had like 2 work permits prior to being hired by them, they didn't check anything about him overseas, nothing. They just took it for granted that somebody else had done it because he had a work permit. That's the slackness, folks, that is happening in this community every single day. Ms. Sue says this is so wrong to bring him to do this job here. Government, who should be in charge of this area, shouldn't let this happen. Well, he came here and he's the house manager for the Francis Bodden home, but we understand that a push is on the way, both from Miss Jennifer Tippett, who's leaving, and others within the organization to actually make him the general manager, which would be the position that Mr. Sidney was in. Now, you can imagine if I already know that information, that's the direction that they're trying to go. How is that possible? It can't possibly be an open recruitment now, can it? What a mess. And in typical fashion, you know, they're accusing workers of leaking information. And where's Sandy getting this information from? Instead of focusing on finding support and help for the young people in their custody and in their care. So what ends up happening is when the kids go home and they have access to a telephone, then they're able to call me and give me a little bit of a heads up on what's going on. Because listen, if you are the manager, the house manager at the Francis Baden Children's Home, and this assault took place under your watch, you need to answer to the board. Why is it that the police were not called? And why is it that no proper independent investigation was carried out? So I don't know who Judith Seymour is, but apparently she is a primary person and pushing for Keith Boyles to get this position as general manager, claiming that he has all sorts of qualification experience and he doesn't have a master's degree. So this person says, please keep me anonymous. My mother was a frustrated single mother of 4 children. Therefore, we got whooping for the simplest things, old school style. These days, it's not called abuse. It would be something simple, like not ironing our clothes the night before school. We were trying to enjoy our youth, but instead we were left with trauma and a few bad memories. I was placed into the Francis Baden girls' home from the age of 14 until 16. I was so excited when I first learned that I'd be placed in a different environment, but I thought wrong. It is similar to the type of prison life you see in the movies. Once you get in the house, you need to know how to maneuver to fit in. I remember my first day moving into the home after my court order. I think the house had about 9 girls living there at the time. Some came to welcome me, and a few didn't like me for no apparent reason. I guess they just felt territorial. Living in that house turned me into a different person. I was a shy and quiet person and used to have trouble speaking up for myself because of the way my mom treated me. It caused a trickle-down effect, which made me get picked on by the other girls. I started to find ways to blend in, so that at the age of 15 was when I got my first tattoo. Then I started to get piercings in other areas of my ears, including my nose, started using curse words and talking vulgar, started having sex, and was placed in birth control, lied about my age and identity to older guys, started drinking and smoking, and being rude to the adults when I know that this was not my real character. I used to cry to staff members expressing my feelings and asking to live with my sister. She was placed with a family member, but instead, I would be ignored and would be treated like the bad kid. I was never a bad kid. The circumstances made me someone I was not because I was in survival mode. Although there were fun times living in the home, I can never forget the bad times as this memory is lodged in my head. I started to get into fights because I had enough. I became a multiple-time runaway to seek freedom, and I used to self-harm as a way of getting attention. I still have the scars to show. I bonded with some of the girls when I learned about their stories, and I remember one of them talking about their rape story. There were some staff members that hold a place in my heart, as they held me until I would stop crying. There were times when I had suicidal tendencies because I used to question my purpose and existence, and there were times that I used to cry until I had a headache. I just wanted to feel heard. That's all. I now hold resentment towards my mother, have major anxiety, and have issues with authority. I think a proper assessment needs to be done when they're placing persons in the home. Not sure if it's being done now. So when you see people running away from the home, don't assume that it's because of a boyfriend. Some of them run away just to get a break from being in that environment. With that being said, we need to pay attention to the children. They're the future, and we don't want to keep raising monsters in disguise. Most of the time, things are happening to them, and they're afraid to speak up because their feelings are being dismissed. Wow. Thank you so much for that and for highlighting that. And what I want to say is, I think that story has been shared so many times with, me from these young people. Like, it doesn't make any sense how you can take a child, for example, this one, who is being removed from a home that is dysfunctional and abusive and put them in an environment with other children who are there for behavioral issues. Like, the two groups of children need to be separated. They need to be treated differently, and there are different types of care that they actually need. The type of care and attention that this child needs isn't what you get in a juvenile detention center. And essentially, that's what Francis Bodden is trying to be, whilst at the same time, it's trying to be all things to all kids, and that's impossible. There should be separate homes and separate facilities for these different types of children. And you need adults who are well-versed with every single case that's coming into the home. And I don't know what they do. I mean, I'd be interested in maybe sitting down with this young lady a bit more and hearing more of her story. But what sort of integration programs do they use to bring young people into the Francis Bodden home and integrate them with the existing residents? Sounds like they just plop you in there one day. And as this young lady said, it is your responsibility to figure it out and to figure out how to fit in. And it becomes a sink or swim type of situation. That's horrible, because that is not what should happen. So again, that makes me wonder if the home supervisors, managers, and caretakers even have so much as a clue from a professional perspective on how to handle these young people. Damien says this is why many Caymanians can't get proper positions in the private sector, and our own government discriminates against Caymanians and have no confidence. I've had many expats even smirk and tell me to my face, many minds still stuck and believe in that colonial mentality. You Little Brat says it's important that people know the facts because a person cannot be forced to participate in any recovery process. CHRC is a professionally run facility, and this lady haven't an idea how many people this establishment has changed their lives for. Recovery is for all that need it, but the individuals have to want it. And that's true too. So like I said, I don't think you can necessarily force anyone to remain in treatment. Ruby says, as a child who grew up in a care home, I can say that you will always end up with people who work in care homes who don't give a shit about the kids in the home and who will be there, who will go their way to make the kids get in trouble. It's messed up. Thank you for our radio listeners. We're going to go ahead and end the program now for them.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's
Nothing happened. Okay. Let's continue with some comments. Thank you, Ruby, for that. And I agree. Miss Darlene says maybe the excuse is that they don't want our locals managing because our locals will make their locals get away with unacceptable behaviors. Maybe they're doing the same thing in our police force and our Majesty's prison, and maybe it's working its way to our customs department. Well, I mean, you should never have the majority of any one nationality in a place, because then that nationality ends up really taking over and looking out for their own. And we see that at the prison. We see that in the police force. And I dare say even at the CAYS Foundation, that's exactly what's been happening for a number of years. So Katsina says children are locked up like dogs, pretty much. OMG, SMDH. Where's the government? Are they sleeping? Government, wake up. Thank you, Miss Brenda. Rapists and child molesters should get an automatic life sentence. Thank you for that. Yes, they should. Jonathan says it won't be long before the government tells us that we need to borrow another $200 million to extend the boys' home, girls' home in prison. And whoever they get that money from will be glad to loan their money to our government with interest. And guess who's going to have to pay for it? So, we keep highlighting these issues in relation to the CAYS Foundation, and not once have we had anybody, not the ministry, not the minister, or not even the CAYS Foundation themselves, address any of this. And to me, that speaks to their lack of interest in our children. They don't really seem to care. If they were bothered, they would say to the community, Sandy's got it wrong. What she's claiming is happening actually isn't happening. Or She's got 50% of it, right? Or whatever. And we're investigating this. We're looking into it. The radio silence, to me, is what is most disturbing. It really, really is. And so, I don't know what else to say, except that we'll continue to bring these issues up. And until we start to see, some success stories here, which we haven't, I will continue to say that I'm alarmed and I'm concerned about what is happening to our most vulnerable children. And someone has to speak up for them. As a community, we cannot allow this to continue. All right, folks. Tomorrow is going to be Tuesday. Health City's on hiatus for the summer, so they won't be back with us until September. So we'll have open mic opportunity tomorrow to talk about a number of different things. So please tune in. 7:30 to 10 a.m. is the time for the show, and we'll continue talking about these issues that matter to us here in the community. Until then, you guys.
Thank you for tuning in to another episode